Welcome to this episode of Oncology Data Advisor. Today I have the pleasure of being joined by Tim Barnett, who is the Clinical Program Manager of Specialty Manufacturer Services at CVS Health. So at ASCO earlier this summer, he presented an abstract entitled The Impact of Multiple Pharmacy Use on Medication Adherence in Individuals with Colorectal Cancer. And today he's here to tell us some more about this research. Dr. Barnett, thanks so much for coming on the show today.
My pleasure. Thanks for inviting me.
To start off, would you like to introduce yourself and share what you do at CVS Health?
Yes, thank you. I'm a clinical program manager for CVS Specialty. And in this role as a certified specialty pharmacist, I develop, maintain, and enhance partnerships with specialty pharmaceutical manufacturers. I present therapy capabilities and available clinical services that our company offers to help acquire product access and gain market share. And then lastly, I monitor the oncology therapy pipeline and manage all facets to new product launches.
Awesome. Glad to have you on the show today.
Thank you.
So looking forward to learning more about this abstract from ASCO. So for background, I'd like to tell us a little bit about what exactly is multiple pharmacy use and what are some of its unintended consequences?
Yes, and for this abstract, we defined multiple pharmacy use as patients that are utilizing more than one pharmacy for medication fills for all the drugs that they are taking, as we did some research into our pharmacy benefit manager members that we sampled. Now, given existing literature for those patients that do use multiple pharmacies to piecemeal their drug regimen together, it's generally associated with a 10 to 31% increased likelihood of medication non-adherence across multiple chronic disease states compared to those single pharmacy users. So that's really kind of what we went into this abstract having that information.
Great, thanks for the explanation. And what are some of the specific impacts of multiple pharmacy use for patients with colorectal cancer?
That's a great question. The objective of our analysis was to assess multiple pharmacy use and adherence in a cohort of patients with colorectal cancer, or what I'll lovingly define as CRC. And we selected CRC on purpose because it's the third most common cancer diagnosed in both men and women in the US. And these patients generally have some comorbid conditions and complicated multiple drug regimens that really make it difficult for a path to proper adherence. Now, not to bury the lead for our abstract, but as we look at kind of the conclusion section of this study, it clearly indicates that individuals with CRC that are receiving some oral oncolytics that do use multiple pharmacies show a 29.5% decreased likelihood of optimal adherence compared to those patients who only utilize a single pharmacy.
Great, thanks for the background. So I'd like to tell some more about how you went about designing the study and assessing the data.
Yeah. In this study, we selected pharmacy benefit manager members, so PBM members, who had at least 2 fills of oral CRC oncolytics of regorafenib, encorafenib, or trifluridine tipiracil, filling at specialty pharmacies within the 2022 calendar year. And these patients needed to have a qualifying diagnosis of colorectal cancer and continuous eligibility coverage for 180 days prior to study initiation. And as we mentioned, we assessed multiple pharmacy use to look at patients that were filling multiple drugs at multiple pharmacies versus those single pharmacy users. And the way we measured primary adherence, our adherence metric, was by medication possession ratio, or NPR. And that's defined as the number of days supplied divided by the days in the evaluation period. And we consider optimal adherence to be an NPR greater than or equal to 0.8 or 80%.
Great. And what results did you find in the study?
Yeah. I have to first shout out to my analytics team who did a lot of the heavy lifting here because they really did a lot of the patient selection and statistical methods by which we arrived at our results. But we had a total of 891 members that met the inclusion criteria, and 362 of them met the definition of multiple pharmacy use, which is about 40%. So it's a pretty significant number. As we looked at what the results found, the members that had multiple pharmacy use had significantly lower adherence, as indicated with adherence rates of 76% and an NPR of 1.06 for the multiple pharmacy users. And if we look at that compared to the single pharmacy users, the adherence rates were much higher at 81.9% with an NPR that's much more superior of 1.15, again, for those single pharmacy users. And we controlled for, the specialty pharmacy type, medication use, gender, and we can see that multiple pharmacy use was significantly associated with decreased likelihood of adherence, which was pretty significant.
Awesome. Thanks so much for sharing the results. So are any of these findings surprising to you or particularly striking?
One thing that we found to be, perhaps striking was the fact that our adherence results nearly matched identically what was found in current literature. And again, with 29.5% decreased likelihood of adherence for the multiple pharmacy users was almost, perfectly matched with what current data suggests. Now, one surprising finding that we did uncover was we did note that male gender was associated with significantly higher likelihood of optimal adherence compared to our female patients within this cohort. Obviously, more studies will be needed in this disease state or perhaps others to find out if there truly is a reason for which male members were more adherent than female members.
That's a really interesting finding, and it'll be definitely interesting to see if there's any reason for that uncovered in the future. So in light of these results that you found, do you think that any changes should be made in patient education or any other clinical changes for patients who are utilizing multiple pharmacies?
Yes, and this is really the part that CVS as a whole, CVS Health, really wanted to capture. And as our next steps, we have really a three-part plan to move forward with these data. The first is that we can see that having all patient medications, both specialty and retail and infusion and everything, filled within the same pharmacy institution may yield higher adherence. And the advantages that we're now kind of talking about internally with CVS Health is that CVS Health has the ability to utilize our Quorum infusion locations to help support patients on the infusion components of their therapies. We have our CVS specialty or Care Plus sites, which obviously allow patients to manage the specialty component, especially in particular oral products. And then our retail stores for CVS Health can also accommodate retail drugs. So we're really trying to do our best to encapsulate those patients to allow them to fill, within those CVS Health institutions. Another initiative is that we're trying to help streamline patient communication and collaboration between these three different facilities by working on a unified communication platform. We're lovingly calling it a super app, where we're developing a way for a patient to go either to a device, their smartphone, and be able to see medications in all of these different locations all in one place. That'll really make it more convenient for a patient to manage, especially if they need to get these, in kind of different avenues. And lastly, our organization does recognize that there are some drug access gaps. There's some limited distribution products that CVS Health does not have access to. And our trade team is working on closing those gaps to allow the patient to remain at that singular pharmacy so they won't have to kind of piecemeal their drug regimen together due to an access issue.
Awesome. That's great to hear about all these initiatives. So do you have any next steps for this particular study or research?
Yeah, now we discussed the next steps for these CRC patients, which we're undertaking, but it's actually going to be more global than that, because while we do see that this will benefit the CRC patients, we know that other oncology patients will also benefit. And obviously, we may even branch out further than that, but we would like to delve into two other large populations of oncology patients by repeating this analysis and then also supporting our efforts that we have with these patients in particular, looking at breast cancer patients and prostate cancer patients for these PBM members, because we really feel that these patients as well will benefit from the initiatives that we're taking with our CRC patients, especially with the complex medication regimens and the comorbid conditions that they all also suffer from.
That's great. Looking forward to hearing more about those studies in the future as well. So as I wrap up today, do you have any advice for pharmacists as well as other clinicians about counseling patients regarding medication adherence?
Yes, and I think this is probably the most important, comment that we can discuss. And not only should clinicians have empathy as a part of every conversation with a patient, especially those afflicted with cancer, but also I think what's important is honesty and recognizing that adherence isn't easy, especially for complex regimens like those afflicted with CRC. Where they are likely going to have to get different medications during in different venues, if you will, and providing these patients with the benefits and clinical support is really how they're going to be most adherent. Now, this is where setting therapy expectations, in particular adherence expectations, are really important as like a valuable tool, and stressing that during all of our, kind of one-on-one or discussions with patient and their healthcare team, so that they really stay on track with therapy. And then I think as a side of the pharmacist or technicians or nurses, those clinicians, continuous training and education is an essential component of pharmacy staff. So that keeps them up to date. That definitely really, let's say, enhances their ability to have these meaningful conversations with patients. And really that extends out, not just, pharmacists, nurses, but technicians, and really the entire care team, I think, would benefit for these types of trainings.
Wonderful. That's some great advice and a great message to wrap up on. So thank you so much again for coming on today to tell us all about this research and the broader initiatives that CVS has going on. It was really wonderful to hear about.
Thank you. I appreciate being here.